right, we're back again for another episode of Coffee with Doc, episode number 37, closing in on the big 4-0. Today, I have my nutrition consultant and exercise. Like we're gonna change the title for you actually, and I think what we're gonna come up with is like what metabolic.
That was my last title, metabolic specialist.
Yeah, metabolic specialist.
Yeah, that
Yeah,
works.
because I mean it's just not nutrition, right?
No.
So and we're going to bring in some new services here at Ageless Forever, and I wanted to talk about them today. Paige has a extensive background with these services, and I think they're going to be very beneficial for people in the healthcare uh, or wellness industry. And if you're focused in that area, what we're going to bring in, and we already have, we're doing resting metabolic rate. We're doing VO2 max testing, and we're in the process of finding a DEXA scan. So we'll do the DEXA scan to look at bone density, but we'll also be using that to do our body composition analysis. Much better than the current method that we have, which is triple wave impedance, which is very good, but we're seeing some results on the machine that just intuitively do not make sense. And so uh, when that type of stuff is brought to my attention, I say, well, what can we do better? I want to make sure we're offering the best that we can for our patients and the public. So with that being said, let's break these down into the
Yeah.
individual tests. Let's talk about the DEXA scan body composition analysis and
Yeah.
kind of what it is and why we're going to test it. And you've done a great job of writing all this stuff up. So it'd be real easy for you to talk about.
Yeah.
So,
So yeah, we can start with the DEXA. DEXA is by definition stands for DEXA, dual energy X-ray absorptiometry. So it basically is a 3D model. So the one we have right now is a 2D. It's accurate, but it doesn't do the visceral fat down to the pound. It should be in pounds, not square inches. So you're looking for a volume. Okay. So basically, we can figure out the visceral fat. So if you're at high risk of heart attack, diabetes, things like that, but exactly how many pounds of muscle, fat, and bone in each arm, each leg, your torso. So if people have injuries, you can see how much you've atrophied.
oh, really?
Yeah.
Okay.
So
Yeah. I
there's
mean,
a lot of things to it.
and we've talked on our podcast before about the difference between subcutaneous fat and visceral fat.
Yes.
And just as a brief reminder, that visceral fat, those fat cells don't multiply typically, they just get bigger. And as they get bigger, they're pushing the other cells that are around them further away from the blood source. And then those cells start to scream. And how do they scream? They release inflammatory cytokines and that's what really causes inflammation. So that those inflammatory cytokines are in a way for them to just tell the rest of the cells in the area, I'm dying. I don't get enough blood. And that's them screaming. And so we get an upregulation of those inflammatory cytokines and inflammation, right? It's the lowest common denominator for most diseases. And the biggest concern for me when it comes to inflammation is what that's doing to the inside lining of the blood vessel, because even if you have normal cholesterol, high inflammation disrupts the integrity of that inside lining of the blood vessel and allows cholesterol to deposit there. And when it gets on the other side of the blood vessel, it's recognized as a foreign body, and the white blood cells that live there, called macrophages, will gobble that fat up, and that's what starts the fatty streaking in the blood vessels.
Yes, and the how the DEXA works is basically it's just a flat bed. You lay on it. It takes about 10 minutes. An arm slowly moves over your body for the X-ray, and then you just can't be pregnant or at risk of being pregnant for it because it is low dose X-ray, but it's lower than what you're exposed to environmentally if you were to fly from New York to LA. So
yeah, if you're going to cross country flight, you're going to get more
yeah,
X-ray exposure than you would from doing this scan.
Yeah.
But we're still going to take the necessary precautions and, advise against somebody who's either pregnant or potentially pregnant. So there's a size limit to this as well, huh?
A
to
what thing?
the DEXA scan?
Size limit, yes.
Yeah.
So the basically the hard limit would be 450
Hmm.
of weight, depending on the model. But the arm also, which goes back to the visceral fat. A lot of guys have the firm beer gut.
Yeah.
I've had one person in the thousands of scans I've done not be able to fit under it because they had so much visceral fat.
Oh, wow.
So that's the only other. But basically, if someone is too wide as well, you can scooch them over, and it will mirror the other half of their body.
Okay.
So you still can scan the majority of people.
Okay. So if we end up with somebody that's a little too big, well, then we can use what we have with the triple wave impedance testing to give us an idea.
Yeah.
I mean, well, obviously, if they're that big, we already know that they're going to need to lose
Right.
significant amount of weight, and that's going to be our goal.
Yeah.
Right.
Unless they're, bodybuilders too, sometimes their shoulders, but
Well, yeah, but that's not going to prevent them from going over the top of them. Their
right.
shoulders aren't that big, right? So, but we can do half of them,
Yes.
right?
Yeah.
So, let's see.
I don't know if anyone would be able to see, but the other important part, like you were saying, is the bone density.
Yeah.
So, especially for women as we age, obviously we're at higher risk of osteopenia, osteoporosis. So if you fall, you're going to break your hip.
Yeah.
And that could put you out until, well, the rest of your life.
Well, what's interesting about that is that fall with the broken hip, and I've heard different numbers, but it's about a 20% mortality. What that means is 20% of elderly people that fall and break their hip die within a year of the hip fracture. And it's not generally due to just the hip fracture alone. It's more due to the immobility. So because they're having to lay around to heal, then they get bed sores, which can get infected. They can get blood clots. They can get pneumonia because they're not moving around. So it's that immobility that needs to be in place for them to heal, but that's what increases the risk. And the other interesting part about that is a very small percentage of those folks regain the mobility that they had prior to the fall. So they're on a downward spiral from that point on in most cases. And so, you might ask yourself, well, I don't want that to be me. Or you might say that to yourself. And what can I do to prevent that? You need to work at preventing that now. And I don't care what age you are. If you're in your 20s and 30s, this is the best time to be working on your bone density. If you're a female in your 20s and 30s, start picking up heavy shit. I'm sorry, but you need to lift some heavy weights. And well, I don't want to look like a female bodybuilder. Trust me, you won't. Okay. Ask any female bodybuilder how much they've sacrificed to get where they're at. And I love it when people say, oh, I get big real quick. Okay. So you're the 1 in a million or billion, right? No, you don't. Pick up some stuff. That's what's going to improve your bone density. You have to have that axial load. So whether you're deadlifting, whether you're squatting, there's all types of carries that you could do with weight. Do something with some amount of weight. The other thing, jumping. Jumping really improves bone density. So, jumping rope, but what I mean is jumping like box jump. Get up there, jump down. Having that kind of load when you hit the ground, and I can't think of the word I'm looking for, but the impact of that does improve bone density. So men and women, I know it sounds like I'm picking on women, but it's typically women. But I should really reframe that, because in today's day and age, everybody sits at a desk and works at a computer, and they go home and they sit and watch TV, or worse yet, play video games. And, so we're not as active as our forefathers were, in my generation, the generation before that, and it just keeps going back. We were much more active and we're not. So, good diet is essential as well, but really it's the exercise. You have to do some explosive movements and pick up some heavy things in your 20s and 30s. Okay, well, I'm 40 or 50. It doesn't change. It's the same stuff. You're just going to get more from it if you're younger. As we get older, that's when the hormone aspect comes in, and we can start adding the hormones in to allow for a better result from your efforts with lifting and having impact on the bones. And you want to maintain that throughout, because that's the key. I mean, I remember I tested my mom's bone density. I don't know why she was so thick, but she was in her 80s. And I was just like, if you ever fall, you ain't breaking nothing. And the only thing she ever broke, she fell down some stairs in her 70s and she broke her arm putting it out, which, okay, that was understandable.
Yeah.
But never had she broken a hip or anything. It was just, she had great bone density. And I think it was from waiting tables her whole life and carrying heavy trays. I think that's only because she didn't exercise. That was for sure, all right.
And if anyone is older, like to the point where you can't, or mobility is bad enough, you can't do a box jump or you can't jump. I've had patients in the past just stomp their feet. Stomp your feet as hard as you can for like 30 seconds straight. Do that 3 times a day, a couple times a week, and it'll help. But you're right. It does. It gets, as you get older, it gets harder and harder because you're on the decline. So
well, and it's can people put on lean muscle mass in their 70s? Absolutely. The studies validate that. So you can, if you've been lifting your whole life and you're in your 70s and you're continuing to lift, you're not going to put on the lean muscle on because you're on the decline. But if you've never done anything and you start doing resistance training, yes, you can absolutely put on lean muscle mass. And so, and improve your bone density. And that, I mean, we talked about it before, but that's where female hormone replacement really started from, was to improve bone density. And then we started to see a plethora of other benefits. So, all right.
Yep.
We're going to go
RMR?
RMR, resting metabolic rate. You're up.
All right. So the second test we're offering is the RMR, which is the resting metabolic rate. It's the most accurate way to test how many calories you're burning just at rest, doing nothing. Of course, you add in, to get your total daily energy expenditure, you have to add in like what you're doing for exercise, which is the VO2 will get to that. And then you have like the thermic effect of food and whatnot, but that's minimal. So
how does the RMR differ from what's most typically talked about as BMR, the basal metabolic rate?
It's just a truncated test of that, essentially. So the BMR includes like when you're sleeping, which, is a percentage of reduction over time because you're awake for this one, and then adding all those other things.
Well, I mean, for me, it's just BMR. This machine does it. It doesn't have it. It's just calculating height and weight.
Oh, yeah. So that's not a true BMR.
Okay.
That's just, based on algorithm. So the same thing with like if you put your stats into a treadmill or a watch, it tries to tell you how many calories you're burning. It has no idea because it needs to measure the oxygen exchange. So basically, you sit in a chair and breathe through a tube for 10 minutes. And for every molecule of oxygen that's missing, you are burning calories based on that.
Okay.
So it actually measures. And then the exchange ratio, too, of how much CO2 to O2, you can tell if it's coming from fat or carbs.
Okay. All right. Well, that's pretty interesting. That's why they have those. So they have, I know there's some companies that have some things like that you can just breathe into, and it tells you kind of where you're at as far as ketotic state. First, it's not so much ketosis, but they're telling you that you're burning fat, right? Because it's looking at that ratio with oxygen and CO2.
Yeah, and it's not that if it says you're burning 100% fat, it doesn't mean you're necessarily burning fat, your own body fat. It could be that you're doing a low carb diet. And so when people come in, to see us and they tell me, I've been doing low carb. Well, if
we can just do that test and find out
well, either you're lying or you didn't follow the protocols.
Okay.
Yeah.
Okay. No, I mean, it's nice because, I don't like to think that people are being dishonest, but here's what I really think is happening. They perceive that that's what they're doing when indeed, when you really break it down, they're not. Now we have a tool that we can measure it, and it's not to call someone out and say, aha, we caught you, you're lying. But no, because it's really a tool to help us educate them, because if they think that they're doing a low carb diet and indeed they're not, we want to help educate them so they can get the goals that they're looking for. And some people really don't understand the difference between carbs, protein, and fat.
Yeah.
And to us, it's almost intuitive,
Hmm.
but for a lot of the population, it's not.
Right.
And so they might just think, well, carbs is just sugar. If I stayed away from all candy and I didn't eat that, but I'm eating a lot of rice because that's a grain that's healthy and that's a lot of carbs.
So,
Oh, but they may not know that. And I'm just using that as an example, right? So this will be a great test for that. What else?
um, so uh, yeah, like I said, you add the VO2 into that. So I guess we can kind of transition into the VO2.
Well, I think there's more to talk about here.
Okay.
I don't know. I'm reading what you put
I
in
didn't know
here.
if you had
So
questions.
yeah. So like I'm gonna quote what you put in here. It's a myth that everyone who is overweight has a slow
Oh,
metabolism.
yeah, I did want to bring that up.
And likewise, not everyone who claims they can eat anything they want to and not gain weight
Hmm.
has a fast metabolism.
Yes.
Find out how many calories your body is burning, and only then can you solve the equation for both fat loss and muscle gain. So
Yeah. So uh, yeah, all the people that I've tested, almost every single one of them who comes in and they blame their genetics or they blame their metabolism and they think their metabolism is broken. It's not your metabolism that's broken, because the more mass you have, the more calories you're going to burn in general. But also, people who are overweight, they need more skeletal muscle to hold themselves up in general. Like, you never see someone who's been overweight with like stick calves. It just doesn't happen. So that also helps to increase the metabolic rate. And then, but their metabolism is broken. Their habits are broken.
So
So,
and this opens up a lot of questions for me.
mhm.
One is we know that their mitochondria, if they're metabolically, and I call it metabolically deranged, but just metabolically unhealthy, a lot of their mitochondrial function is not
Compared.
as good as is
Mhm.
a healthier person's.
Yeah.
And then we can help that with some peptides and improve their metabolic function, or like methylene blue or something like that, good quality methylene blue. So those are things that can help the metabolism, and then just turn your body's ability to take that fat and put it in the furnace and burn it and get as much fuel out of it.
Mhm.
And another thing I just wanted to counter a little bit with it was,
Mhm.
you would think, so to your point, maybe the legs on an obese person are big. But what do you think about their paraspinal muscles?
Oh yeah, no, that's the only exception. But and also, as they lose the body fat, the rest of that muscle comes off usually.
Well, and so that brings up another good point I want to make. But so it was interesting because you would think those really heavy people would have real thick, strong lower back muscles, and they don't. A lot of them don't. And so that puts them at greater risk for a muscle injury, for a back injury, right? So that core isn't strong. Now, when it comes to the muscle size, and this is something that I've thought about, because I think about, why I started thinking about this is when we started saying, oh, all the people that are taking the GLP-1s, that are overweight, they're losing muscle mass. And I thought, well, we're not seeing that in our clinic, because we're really paying attention to the protein intake. We're using tools to measure their body composition. And if we see that, we encourage them to increase protein, decrease a little bit more of the carbs, improve their exercise. And we're kind of mitigating that to some degree. But the other thought, I absolutely love Wagyu. And I love A5 Wagyu. And if you've never seen A5 Wagyu, it looks like a big lump of lard with little bits of muscle in between. And that muscle, so if you're measuring that muscle belly, it's big. But if you take all the fat out and you just get down to the muscle fibers,
right,
it's a lot smaller. So the piece that you order, when they start to cook it, it shrinks up pretty damn quick. Now, it's still buttery and yummy, and I just love that stuff. Don't eat a lot of it. But I do enjoy it. And honestly, you can't. When I thought I was going to be Mr. Big Shot, and somebody said, "You want a Wagyu?" And I said, "Sure." Well, how many ounces you want? I'm used to, at the time I was eating, a 16-ounce steak, no problem. And they said, well, I said, why don't you give me a 10-ounce Wagyu? Well, not only did it cost me an arm and a leg, which was a different story, I couldn't barely, I mean, I forced myself to eat it and was not feeling well. if you ever want Wagyu, I don't suggest ever getting more than 4 to 6 ounces. That's it. It's so rich. You don't need any more than that. It's just there's a public service announcement for you. Um, but back to my point, these really obese people, that muscle belly is flooded with intramuscular fat. So it looks like it's a big muscle belly, but it is not lean, healthy muscle. And when there's fat around those muscle cells, that can tell you that those muscle cells are not healthy, and their mitochondrial function and their ability to metabolize carbohydrates and transport, to do the things that normal muscle cells through physiology are supposed to do, they don't do it well.
And that reminds me, so on the DEXA, you can visually see the outline of the muscle is a different color than the fat.
Mm-hmm.
This was halfway through my journey. I wish I had my old ones, but you start to turn a darker shade because of the muscle density. So like
darker with more muscle density?
Yeah. So like you see the red is the fat around.
Yeah.
So there'd be red in the middle of the green, and the green would be, and then it would slowly start to change.
Oh, okay.
So you can visually see too.
So with a keen eye
Mm-hmm.
and a really good printer,
Yes.
right?
Yeah.
So, okay.
It's just cool for people. Cause it's also, it's motivating too. When you know that you're going in the right direction, you can see that. Especially if you just start weight training and you're not confident in the gym and, all that stuff, to keep going, it's important. So
I have one last question on this, and it has nothing, like, not directed to you, but to our silent member in the room who's in here helping us split this podcast together. Is there a way that we can put this up? Absolutely. Okay.
Cool.
So Roderick is our silent member in here helping, he's been with me pretty much since we started this podcast and helping film and edit and do all the stuff that we need to do. And so now we're going to get him to pop on here, and he's like, no. But, Roderick's going to put this up so you folks can see what the results of a DEXA scan look like. What is the black and white part?
That's just another image.
Just
You
similar to, but its color's the best though.
Yeah.
Okay.
So
very cool. I don't want to get into Z scores and all that stuff. That will save that for another time when we talk about doing DEXA by itself.
Mm-hmm. Back to your point on the RMR though, with the people and their metabolism, it really comes down to the people who are overweight, who have faster metabolisms. They're eating much more than what they think they should, and they're sedentary, of course. Mm-hmm. So those are the two factors that are really causing them to gain and gain and gain.
Well, there is, there are some genetic factors too that make it, one more prone to it, and they have to work a little harder. Yeah. Right. So,
but it's not just based off of your muscle mass. So
no.
Yeah.
No, but I think like when going back to what we talk about, I'm thinking, BMI is height weight. I said BMR, so I have to correct that. BMI tells us nothing like that. But that BMR on here it's still pretty much just going off of height, weight, and then looking at the body fat percentage.
So
right?
Mine, obviously, I'm an exception as a bodybuilder. I have a lot of muscle and I'm also very active, burning more calories. But that says I burn about 1,000 less than I actually do.
Okay.
So
because you've had your RMR done, right?
Yeah.
Okay.
So
that's important, though. I mean, that is one of the few reasons that we're upgrading to what we're doing, because we want to have the most accurate data so we can help people reach their goals much easier, but scientifically. We're using data set points and then improving upon them. Okay. Let's talk about I'm going to call it the mother, but it's really, a lot of you, when you do it, might call it the motherfucker, because VO2 max. So
yes,
let's go slow through this one, and so people understand. You even use, excuse my French, fucking stupid. All right, that kind of caught my eye. So let's delve into the VO2 max.
Yeah. So the VO2, basically, if you've seen, the old Gatorade commercials where the person's running and they've got the mask on their face with the straps around their head, that's basically what a VO2 max is. Over the course of 10 minutes on a treadmill, or you can do it on a bike if you're a cyclist. But it tells you, basically, you take someone from breast slowly up to 95% of their max heart rate, which is 220 minus age times 0.95. And so
So we're doing this off of age. Okay.
that's just the approximation.
Okay.
But then
Yeah.
I can see on the graph where they actually hit their anaerobic threshold. So, but it basically is going to tell you you're burning, fat, and then the oxygen demand is too much as you go up, and then you get to a point where your body cannot oxidize fat anymore. It has to go completely carb, sugar, anaerobic, and if you run out of fuel for that, you're going to tap into muscle. So you're going to lose muscle if you're working out too hard for too long. But also it's going to be difficult to do that. But it tells you how many calories you burn at each heart rate leading up to that point.
Okay.
So if you do like Orange Theory and heart rate zones, there you go. You have your accurate data as opposed to just a general zone for men and women that they give you, which means nothing.
Okay.
So, but you asked.
So there is something good about Orange Theory.
Yeah. Okay. Just
I'm sorry.
a theory. Yes. Yeah, and it's the test is a VO2 max. So if you want your max, you're an athlete, you're going to push yourself until you tap out. Like you're max. You want to rip the mask off because you cannot breathe.
Okay.
Yeah. But if not, you're pushing yourself to that heart rate, and then we end the test. So.
Okay. So again, lots of questions. Yeah, lots to unpack here, right?
Yeah.
I can tell you I've never done a VO2 max test, but I've done PT tests with a gas mask on.
Yeah, it feels similar.
And it sucks. You want to rip the mask off because, now gas mask, and again, I've not done this, but you're actually pulling your diaphragm is actively pulling air in when normally it's a passive motion, right? But the diaphragm has to contract to breathe, but I mean, you're actually forcing that air in your lungs because the gas mask is so restrictive. Is that the case with this that you actually, you've got to pull hard, right?
Well, yeah. But you're also exerting yourself to the point where you have to,
right?
You're going to, and you can do it through your mouth or your nose, it's just one mask. Mm-hmm. And yeah, it's as hard as you want to make it. But the important thing is you get your aerobic threshold, your anaerobic threshold, and you know what your heart rate zones are and where you're burning fat versus carbs. And overall, your VO2 max is one of the top 3 predictors of longevity.
Mm-hmm.
So.
Yeah, I know. I listened to Dr. Peter Attia speak on the drive, and that's, he really pounds that home. And I'm like, I really don't want to do this thing. But, I know it's for the greater good for not only myself, but my patients. And so, as with everything else I do, I always do it before I recommend it to anybody. The only thing, the exception I make is I don't take women's hormone replacement therapy. But everything else I'd ever recommend, I do. So this is something that I got to just cowboy up and do. And I'm not looking forward to it. However, and now I'm making it sound like you don't want to do it, but it gives you a lot of good data, right?
Yeah.
What if somebody's claustrophobic?
That is a factor.
Mm-hmm.
I tell them you can stop at any point in time. Just give me the hand signal or tap on your mask and we'll take it right off and we'll just stop the treadmill. End of test. Okay. But usually I let them sit in the, stand there with the mask on for a minute just to kind of get used to it. Mm-hmm. And also know that you're not on a limited oxygen supply. Even though you have a hose hooked up to you, it's just going right through the machine. So it's not like you're, going to actually be, yeah.
And then they're going to go till they get to that effort. But if they perceive that like they're getting dizzy or, just stop. Yep. Right. It's, we don't want you to get hurt. We're not looking to do anything like that. We're trying to get you the best information possible. Yeah. Right. I hear Dr. Attia speak about numbers.
Yes.
Right?
So your VO2 is the volume of oxygen consumed per kilogram of your body weight. So even if you didn't work on your fitness at all, if your weight went down, technically your score would go up. Okay. And these are just
another thing Rod can put up for us.
Yes. Lots of things. So men usually being larger in structure on average and larger lungs, their scores are a little bit higher than ours, but still it ranks your fitness level based on your age as, poor, fair, good, excellent, and then like Olympic essentially. So those are, I assume, the numbers he was talking about.
Yeah, isn't that interesting,
Mhm.
man? Now I'm gonna make a comment. Okay, I'm just looking at this chart, and Rod's gonna put this chart up, right?
Yes.
So when you look at the chart,
Mhm.
I you can cancel me if you want to. I don't give a rat's ass, right? But the VO2 max for superior for a 20 to 29-year-old female is 50 plus. Okay. That's the same superior level for a 50 to 59-year-old male is 50 plus. So please don't tell me there's no friggin' difference between males and females. And I'll give you this much: biologic males and females. Okay. So you're going to tell me that, oh, because I couldn't really compete with all the other biologic males, so I'm going to put on a skirt and compete with the biologic females and win. Oh, that there was no difference. I'm sorry, cancel me. But this information actually validates that.
Yeah.
So I'm off of my
Yep.
soapbox with
Yeah.
that.
And your hemoglobin, your red blood cells, all of that ties into it too. But most people fall in like the fair, good range.
For their age.
Yeah. And a lot more than I'd like to admit are poor. So we want to get you as high as possible, but there's a genetic component, and they say technically you can't increase it more than overall like 20% of what it,
Mhm.
but there are other factors too. Like if you're traveling and you're an endurance athlete, for every 4,000 meters of elevation added, I think it's a 26% decline in your VO2 max capacity or your score. And then every 10 years or every decade, you drop 10% on average. So that's why it's important too to do this now and see.
But there's ways to try to maintain that so you don't drop as much,
yeah,
right?
Absolutely. You can improve too. I mean, it's not guaranteed. Yeah.
And I know I've heard some of those ways, and but most of it is doing similar high intensity exercise, cardiovascular exercise. And the one that comes to mind for me is like Tabatas,
Mhm.
right?
Yeah.
So, and if you're not familiar with a Tabata, the one I like because it's short, and people say, well, that's really not a Tabata. But I like, 20-second sprint and 10, 20 seconds off and 20. So I do that with my training partner on an assault bike. We just go back and forth and get, 8, 10 rounds in, and
Mhm.
your heart rate is, I don't know, mine's been in the 170s and you feel like you're going to die. But that kind of stuff can help. I know the other Tabata, I mean, they have was it Norwegian 4x4 or something like that? It's
Yeah.
4 minutes, 4 rounds, and I think it's only like a 2-minute rest.
Yeah. There's a lot of ways to.
But you're all out for 4 minutes, and I think that takes some training because I 20 seconds. I know what 20-second all out means. 4-minute all out. I can't wrap my head around that.
And
Like, what is that?
That's almost impossible. Like to hold your VO2 max like number and that heart rate is almost impossible to do it for more than, I mean, unless you're specifically training for it and you have superior score. I mean, you're not going to be able to hold it for minutes, let alone hours. So, yeah, it's basically what you're saying. Like any kind of high intensity training, you want to tap your VO2 and then come back down, or your anaerobic threshold. So you have to push yourself to your heart rate's high enough.
Mhm.
And then you come back down, recover. And there was one study, I think they showed you need to do it at least 3 times or only 3 times, like a couple times a week. That's enough to make it move. So that's like bare minimum 3 sprints. I mean, obviously do a little more than that, but like that's where you start. So, and then how far also to when it comes back down into your aerobic zone. Because if you just go again and you're still at like 150 and you go back up to 170, 180 and you just stay in that range, you're technically still in that close to your anaerobic threshold range, which is good, but you don't give your body time to recover. So you're going to be able to recover faster. It's going to be 2 minutes, 1 minute, 30 seconds, your heart rate's back down. And that's how you know too that you're improving it.
Well, that's another good indicator of cardiovascular fitness is how quick you can come back to baseline,
Yeah.
right? If you can get in within a minute, you're good.
Yeah. So this measures that too, because I make them walk for 2 minutes afterwards. So we see how far, as long as they don't want to rip it off. Or
Right.
peak. Yeah.
Right. Okay.
So, yeah.
All right. What about people with, well, if they're at high risk for heart disease, probably wouldn't start doing this test.
Yeah. Well, I mean, you can, but it would just be a walk. It would be a walk. I've had people do a 3 mile per hour walk at like a 3 incline and tap out after like 5 minutes. But then they have their baseline, and then you can improve on that. So,
Okay.
yeah.
But I think one of the important things is, as we progress in our years, there are things that we all envision doing at some point in time. I want to travel the world and I want to do this and that. Well, kind of think about those things. And at 80, what do you want to be able to do? And then we can start looking at, okay, well, I want to be able to walk. I'm going to China. I want to be able to walk the Great Wall and see that. Okay, well, I'm sure that there's a way that we could figure out what kind of the Met is on that and get that capacity. And that can be translated back into VO2 max. And we're going to go, well, in your 80s, you're going to need to have a level of this. And if we assume that you lose 10% per decade, well, where are you now? And what is the prediction that you're going to get there? And what do we need to do to help you to realize your goal? And let's say, what's called the marginal decade was we never know when we're in, but it's the last 10 years of your life. So, something along those lines. I heard somebody say that, making love to your spouse was like a 30, right? And if that's a 30 and you're, and that's important to you and you want to be intimate with your spouse in your 80s, well, and you're in your 40s now, and you're only in your 40s in the VO2 max, probably not going to happen. You're going to have to start working a little bit harder.
Yep.
Right.
Mm-hmm. Yep. And not to totally change topics, but I did want to mention though that how many calories you burn per hour at each heart rate. It's really important to do this test for that, because a lot of people will think based on their watch, I'm burning 4,000 calories every day. Well, why am I not losing weight? And then they think they can eat that many calories back. And when you do, you're probably going to gain, not just maintain. So,
well, with those watches are,
yeah.
From some data that I looked at, I think they're intentionally set high to make you think that you're doing more than you actually are.
That's it.
And in a way that's to encourage you to do more. But then people look at it to your point and go, well, I burned 4,000 calories today. So if I eat this Sunday, it's a net zero. No, maybe not.
No.
So
yep.
That's important.
Mm-hmm.
Okay.
Yep.
What else is on here?
Of course, there are protocols for the VO2 RMR for fasting, and you can't can't be on beta blockers for VO2 max, obviously, because you can't get your heart rate high enough. Yeah, I think that was pretty much. I'm trying to think of anything else. It's difficult to explain until you actually do it or you see it.
Right, but let's talk about patients coming in for their first appointment with you. They're scheduled to do these tests. How should they come?
So if they're going to do all three?
Yeah, we're going to do all three tests. They got whatever time it takes scheduled with you. Right.
So ideally come fasted from overnight if you can, and bring a small snack with you or something to have, like crackers or something, just in case between the RMR and VO2 you need to eat something so you don't pass out on the treadmill. But fasted, no caffeine stimulants. You want to take your medication as usual, but no
falsely elevate the heart rate.
Yes. Okay. No even like nicotine or chewing gum will throw it off sometimes.
Oh, patients are gonna love this. It's almost like coming in for their labs,
Sorry, yeah,
right?
pretty much.
Okay, but drink a lot of water.
Yeah, that, yes. So they'd come in, we do those tests, the DEXA, the RMR. I don't think of the other things. Obviously,
Well,
just bring workout clothes, something
workout
comfortable.
clothes, right?
Yeah.
So shorts, something
Yeah.
something comfortable that you would go to the gym in.
Yeah.
Okay.
Um,
And obviously good footwear,
yes.
right?
Yeah.
This deck goes out to one of my last guests, Jay. You got to wear shoes for this. Well, maybe you don't, brother. You can go barefoot.
Yeah.
Um,
Yeah. And then the hydration thing is true though. You do want to be very hydrated. And then no working out, because working out boosts your metabolism. So you can't work out that day.
okay,
Yeah.
that's important.
Mm-hmm. Yep.
All right. How long do these, like each test? How long do they take approximately?
The test itself, or so the test itself, DEXA 10 minutes, RMR 10 minutes, VO2 7 to 10.
Okay.
Um,
So we're going to a half hour of actual testing and
Yes.
then some prep time in between. So to get them all done, an hour appointment would be about right.
Yeah. And then going over the results. That's really the part that takes the longest.
Okay.
Yeah. Because
So maybe even longer then, huh?
Yeah. Like an hour and a half. Mm-hmm.
So I think, Paige and I discussed this, and we're looking at, each test being, value about $150. So that's what we're going to offer them for. And then if you do all three, it'll be $400. So you'll save $50 and you get all three done. Now, coming up after the first year, Ageless Forever is going to go to a little new membership model. So our new members, this will be just part of the package that they get when they come in. So again, because our goal is really to help people not just address hormones. It's integral, but integrative wellness. And we really want to get people as healthy as possible. And, I will continue to preach this. The foundation is diet, exercise, and sleep. We're knocking two of those out with this and working with Paige. And then the sleep part, well, you guys can remember we had Dr. Gil Suarez on with us and talked about the importance of sleep. We want to help people with that as well. And so when we get those foundations, then we build upon that. And yes, we can start with, hormone replacement and doing all these things, but we don't want to forego the foundation, because, we all know you build the house on sand and it doesn't do very well. So, okay.
Yeah. And the part after the testing is done, of course, you can take the RMR results home and the VO2 max, but I use that to figure out exactly where to set your calories based on your goal. So it's just, I've done it so many times, I can pretty much look at someone and I know, but it just makes it faster and helps. And then we can see over time, as your metabolism increases, if it does, or it drops, how to change it and how much to change it. So
yeah, just more data points that are driven in science to help you attain your goals. And it's not guesswork.
Yeah.
And, there's a lot of people that have just been, winging it, and some people are successful, and more often than not, they're not successful. And they sit across from me and say, well, my diet's great and my exercise is wonderful, but I have this amount of fat. I don't know why. Well, guess what? We can help you get to the bottom of the answer, and right here within an hour. And now we can really dial in your diet, what you thought you were doing well, and maybe find out that you weren't doing as well as you thought you were. And the body shows it, right? So, and it's not to shame anybody. It's just that's what you're doing, what you can with the tools that you have. And now we're offering you more tools to help you reach your goal. That's the key to this. So,
and I have one more point. So on the DEXA, it shows your lean tissue, the exact pounds total. So that they say a gram per pound of your body weight for protein intake.
So we're going to go off a lean.
Yeah, that's even more accurate
Okay.
than doing that. And then, a percentage of that, it can be a little bit higher. Usually you want it a little bit higher, but it doesn't need to be, your entire body weight. You don't need to feed the fat protein. So, but yeah. And then the retesting protocols I wanted to mention too. So,
Retesting protocol.
mhm.
Well, you didn't mention that.
So,
Let's go.
yeah. So when they come back, because you want to obviously measure progress, but usually DEXA, it's because it's low enough dose X-ray. If you wanted to come back and retest in 4 weeks, go for it. I've tested myself every 2 weeks and experimented countless ways. But the RMR, you want at least like 3 months
Okay.
for it to change over time. The same with VO2. VO2 is usually closer to 6 months. But if someone's doing a drastic change, like I don't know, the HCG diet or something extreme, then they'd want to come in sooner. But
Okay.
yeah.
Now, with our planning and with all this information, you're going to help the patients with giving them exercise prescription,
Yes.
per se, of what they want to do.
Yep.
And I think, again, because she's got years of experience in dealing with this and kind of helping people get to the level that they need to. Again, a lot of patients, well, my personal trainer, okay, I understand. What data points are they using? Do they understand this? Are they, and maybe some of them do. And there are some really good personal trainers out there. I've seen some very poor ones as well. So, and it's not to say that, having somebody to be accountable to that's hugely important. But if you're trying to get to be the best you possible, well, then we can do these tests, help you get there, give you an exercise prescription. You can take that back to your personal trainer. I don't care. Paige doesn't care. And then see how well that works. And we can help give you direction to give them. Ultimately, you're hiring them to reach a goal. And we want to give you all the tools that you can and give them the most information that we can to help them be as successful as possible. And I love that idea because, that personal trainer might go, well, geez, that really worked well for this client. Maybe I'll have more of my clients doing this so I can get the best results. And it just helps everybody, not only the clients and patients, but it helps that personal trainer's business because they're actually starting to see success in people that maybe they were having a difficult time with before. So, a little bit more food for thought. If you're a personal trainer out there and you're listening to this and you think this is something that you want to do, come see us because we want to work something out with you as well. So not only can we do this testing for you, then you can experience firsthand. Again, we want to work something out with you. Then you have your clients come in and do it, and we can help you become more successful in your field, become more of an expert.
I was just going to say that, like, we offer discounts to personal trainers for that reason, because if you don't know, what you're looking at, if a client brings you that, like, it's just better to understand it, and yourself, and get more data for yourself. So
100%.
So no,
I think it's brilliant. So,
yep.
We want to help. I guess that's the bottom line. So,
yeah.
What do you think? You think we covered it all?
I did want to mention something about the visceral fat too.
Yes.
So, and also we can talk about, I don't know if you want to mention the cool sculpting and measuring.
Yeah, let's talk about it.
So with the in-body, obviously it is accurate, but it's not as accurate as the DEXA.
Especially with the visceral fat. We spoke about, so we have one patient, well, we've got a few patients, but one in particular that the machine was basically saying has little to no visceral fat. And that doesn't pass the eyeball test with us. No. And Paige just was like, this is what it says. And that's when I was like, okay, let's just pull the trigger. Let's do this. We're going to make an investment in our patients. Right. So that was one of the biggest impetuses to really get this going.
Yeah. Cause it's basically just, it's assuming how much of your fat is deep and whatnot, which this actually goes all the way through you based on your muscle fat and bone absorb at different rates. So that's why it can differentiate. But the visceral fat on that, we just go off of a number of inches squared. We want you to be a 1 or the
centimeter lower
centimeters. Yeah. Sorry. But this is pounds. So I know based on testing all the people I've done, what to look for, what the danger zones are. If you're over 2 pounds of visceral fat, you're going to have your blood markers are going to be off. You're going to be maybe pre-diabetic at that point. And that's just when the beer gut is starting. And then when it gets like that big, you probably have 4 to 5 pounds. And that's like, you could have a heart attack tomorrow.
Oh, you should go. I should send you out and run and go get your little fat thing so people could see it.
Do you want me to?
Is that, but that's all fat. Doesn't mean whether visceral or subcutaneous.
Yeah, it's just fat. So
We could pause this for a second. Yeah. Pause and let's go bring that in so people can see what the fat looks like. Bring the muscle too. What the hell? Why not, right?
Yeah, good man. It'll definitely help with the visual.
Yeah.
But so if you have more than 2 pounds of visceral fat, that's a bad thing.
Yeah.
I haven't checked that out. That's just interesting because it doesn't seem like that's a lot.
Well, when you look at when she brings this 1 pound of fat in,
Yeah.
you'll see how much it is.
Really?
Yeah. You'll be like, I ain't got that.
Yeah.
Right.
2 pounds is crazy.
Yeah.
It doesn't seem like a lot. Oh, sheesh.
Yeah.
Oh, man, how heavy is that? Oh, it's just showing the volume.
Oh, man, is that something?
Isn't that supposed to be a pound?
That's supposed to be a pound?
Yeah. There we go. We were still running? We're just going to edit it?
Yeah.
Okay. There you go, Paige. Here we are.
So that's 1 pound of.
1 pound. Look,
Fat.
this one's even greasy.
Yeah.
Ew.
I tried to clean it off.
Yeah, no, I think they did that on purpose. So when you touch it, you go, "This is disgusting."
Yeah.
So that's a pound of visceral fat versus what a pound of lean muscle feels like.
Yep.
And looks like. So you know, you can see the difference.
So think about
2 pounds of that.
2 of these surrounding just sitting right on top of your liver, heart, and your arteries. That's what happens. And then some people, I've seen up to 13 in one person.
Oh wow! And I wonder, that's so. In surgery, we call that the omental fat, the omentum, because it's like an apron that covers the viscera. That's why they call it visceral fat. But and that's the dangerous stuff. So
Yep. And then also you can see the difference. And I really hate. Oh, sorry. When people say, oh well, a pound is a pound is a pound, right? But this shows the volume and the size. So if you were to look at me and guess my weight, my guess is you probably say lighter than what I am because I have more muscle, but it's compact. You're saying the density. So, as your body composition changes, I think for a while there, I went from 20% probably to 14%. My weight stayed the same.
So you're trading fat for muscle.
Yeah.
Do that all day, every day. Right?
Yeah. Not that easy, but yeah.
No, 100%. But I'm saying that's the trade we want to make.
Yes.
Right?
And even if you're not, you don't want to do bodybuilding, you don't want to get bulky, like he said at the beginning, trust us, it won't happen by accident. I wish. But so just building a couple extra pounds of this, though, will help with building your.
Well, because this is burning calories and
Yep.
this is still metabolically active, but
Not as much.
very, very, very low. And it's, it's not really burning calories per se. It's storing them. That's what it's for.
Yeah.
Right. I think that visual stands out. So
Yeah. And
let's talk about the cool sculpting aspect of it.
So the another thing for Roger to put up, you can show you by section how many pounds of fat you have in your right arm, right leg, left torso. I mean, it's very specific. So in your android gynoid ratio as well.
Okay.
So if you're apple shape versus pear shape, most men are apple or postmenopausal women usually if you gain body fat. And then, that's lower risk of heart attack if you have more fat down below because it's further away from the organs. But with the cool sculpting, based on where you do it, let's say you do it on your flanks. Yeah. We can see exactly how many pounds of fat have gone away.
Oh, which is very cool. Right. So when we do cool sculpting, we take pictures and you can have the visual, but we also now will have a tool that we can measure and see the area of treatment. And now it's important that I just make this point. Cool sculpting is going to get the subcutaneous fat. It will do nothing for the visceral fat. This is purely cosmetic. It's not but in a way, it is a weight loss tool, but I don't like people to think of it that way because you're not going to come in here and go eat what you want forever and just come cool sculpted away. Although I know some people that have tried that, it doesn't generally bear much fruit to do that, and it gets very expensive, unless you happen to own the machine. So.
And then you can see, I mean, it's down to the decimal. Like at this point, I had, 1.6 pounds of fat in my right arm and 1.7 in my left arm. That's why I couldn't see my left bicep vein for so long. I mean, little things like that. It's
Okay.
just cool to see. But also you can see the muscle, and you want to make sure the muscle isn't going down. And that's important too when people are doing, GLP-1 and things like that.
Well, so these are actually your measurements.
Yeah, this is from 3 years.
Okay. Very cool.
Yep.
Very cool.
That's why I can show you, because HIPAA.
Because it's you. Well, I mean, you blacked the name out, but you just identified yourself.
Yeah.
So
These aren't my current stats.
4 years ago, I hope not.
Yeah. No, they're still good, but
Hey.
over time.
So.
Yeah, I guess if people have questions, you can tell them to reach out to either of us. I'm happy to.
You tell them.
Yeah. So if you want to call us, ask for Paige, and I'm happy to answer any questions, or you can email me at paige@agelessforever.net.
Yeah.
Yeah.
So that's PAIGE.
Yes.
Correct.
Mm-hmm.
Right? So Paige@agelessforever.net.
Mm-hmm.
And you can call us 702-838-1994. And we'd be welcome to answer your questions, get you in here to come see Paige, get scheduled to do some of these tests. We're here for you.
Oh, one more thing. Sorry.
That's okay.
So hardcore endurance athletes, we can do an extrapolated or a elongated test for
Okay.
them. So 1 to 2 hours, and it will give them a 50-page report on their VO2, on everything. So
Okay. Are we
you
going to
are-
charge a little different for that?
yeah.
Okay.
Yeah.
All right. So if you're interested in doing that, contact Paige and we'll be able to tell you exactly what we're going to charge for that, because that's a lot of time, but it'll be well worth it.
And if you are a cyclist, you can bring in their, the little, the stand with the bike without the wheel.
Oh, okay. So a stationary bike
Yeah.
that they can bring in.
Yep.
We can.
So we can set that up.
Yeah, we've got enough room in the room to put that up.
Yeah.
So.
But I wouldn't recommend it if you're not a cyclist, because you have to hold the wattage, and it's very difficult. Your legs are going to burn out before you hit anything.
Yeah, I heard Cooter, because he was a cyclist, and I heard him talk about that's how he did it. He's like, it is a monster.
Yeah.
So,
Yep. So
all right. Well, thank you for your time, and we look forward to seeing you in the future.